Hello students and my dear friends. In this session, we'll discuss about viral hepatitis. So this is one of the important topic. So in this, we'll discuss the outline of the hepatitis viruses. So what is mean by hepatitis? So hepatitis, it is a systemic disease where we can see the inflammation of the liver. So as you know, itis means inflammation. So hepatitis means inflammation of the liver. So there are many causes are there for hepatitis. So especially viral infections and some of the toxins and even excessive alcoholism. So chronic or heavy alcohol use and some of the medications are like isoniazid and other drugs and even autoimmune diseases. So in case of autoimmune diseases, as you know, like auto antibodies are formed. So this is like most common in the like women. But in this session, we'll discuss only hepatitis viruses only. So hepatitis viruses, there are mainly five types of hepatitis viruses are there, like hepatitis A, B, C, D, and E. So these are the five hepatitis viruses. So out of this, hepatitis B causes more severe infection. It causes severe infection and it is fatal. Sometimes it leads to the like a death also. And out of these five viruses, again, hepatitis B and C, they causes hepatocellular carcinoma. So they are responsible for hepatocellular carcinoma, which leads to the like a cancer. So they comes under even oncogenic viruses also, which means cancer causing viruses. See, all hepatitis viruses are RNA viruses except hepatitis B virus. So hepatitis B virus is a DNA virus, which means they consist of DNA as the genetic material, and the remaining viruses such as A, C, D, and E, they consist of RNA as genetic material. They are RNA viruses. So we'll like other than these viruses, like there are some other viruses are there which causes hepatitis, but very rarely, like yellow fever virus, EBV, such as epstein barr virus, herpes simplex virus, HSV, adenoviruses, rubella viruses, and enteroviruses. So these are the other viruses which causes hepatitis. And if you see yellow fever virus, so yellow fever virus, it is a arbovirus, which means they are transmitted by arthropods as vectors. So especially like mosquitoes. So they causes hemorrhagic fever and even hepatitis. But yellow fever virus is not present in India. See, these are the characteristic features of different hepatitis viruses. So we'll discuss one by one. If you see the properties, so what is the common name for HAV? So HAV means hepatitis A virus, hepatitis B virus, HBV means hepatitis B virus, HCV, hepatitis C virus, HDV, hepatitis D virus, and HEV, hepatitis E virus. So what is the common name for HAV? That is called as infectious hepatitis. Hepatitis A virus also called as infectious hepatitis. And hepatitis B virus, it is called as serum hepatitis. Hepatitis C virus is called as non-A, non-B or post-transfusion hepatitis. So why it is considered as post-transfusion hepatitis? So it is mostly caused by the needle stick injuries or contaminated blood products. So it is considered as post-transfusion hepatitis. And hepatitis D virus, so it is a delta agent. So common name is like a delta agent. Uh, See, HDV can be considered as defective virus. So we can consider D as defective virus or dependent virus. So hepatitis D virus cannot survive independently. So it depends upon the helper function of hepatitis B virus for its replication as well as the expression. So we can consider it as either defective virus or dependent virus. Next, HEV virus. So hepatitis E virus. So that is non-A, non-B, enteric transmitted hepatitis. So if we see hepatitis A virus, it is transmitted by fecal-oral route, and hepatitis E virus is also transmitted by fecal-oral route. And if you see the family, hepatitis A virus, it is the common name is like enterovirus is 72. It belongs to the family of Picronaviridae family. So, and hepatitis B virus. it belongs to the family of Hepatnaviridae. And hepatitis C virus, it belongs to the family of Flaviviridae. And hepatitis D virus, it is like unclassified. So this virus is like viroid-like structure. And hepatitis E virus, it belongs to the family of Hepaiviridae. And genus hepatitis A virus, it belongs to the genus Hepatovirus. And hepatitis B virus belongs to Orthoheparnavirus. Hepatitis C virus is Hepacivirus. Hepatitis D virus is Delta virus. And hepatitis E virus is Hepa virus. And if you see the virion, so what is meant by virion? The infectious particle of the virus is called as like virion. So the size of the virion is 27 nanometer and it is having the icosahedral symmetry. It is having the icosahedral symmetry. And the size of hepatitis B virion is like 42 nanometer and it is a spherical particle. And hepatitis C virus, it is the size of virion is 60 nanometer and it is a spherical particle. And hepatitis D virus, it is having the size of like 35 nanometer and a spherical particle. Hepatitis E virus it is having the size of 32, like which is having icosahedral symmetry. And next envelope. So what is the like envelope? So envelope, it is like as a outer, it is present as a outer layer only in the like viruses. So hepatitis A virus, they do not possess the envelope. Hepatitis B virus possesses the envelope, that is HBsAg. So hepatitis B surface antigen. So this HBsAg is present in the envelope of the virus. And HCV virus also enveloped virus. They consist of envelope. So envelope, it is lipoprotein in the nature. So remember, like in the viruses, some viruses they possess envelope. The envelope, it is lipoprotein in the nature. And hepatitis D virus also possess the envelope, which means HBsAg. As I told you, like um, it cannot survive independently. Like it depends upon the helper function of hepatitis B virus for its replication as well as expression. So here, like as it depends upon hepatitis B, so here also like HBsAg only. And hepatitis E virus, they do not possess the envelope. And stability, like hepatitis A virus is heat stable and acid stable. So they cannot be easily destroyed by the using of the heat, and even it is acid stable. So that's what it is entered by the like fecal route, and even after that they survives. But hepatitis B virus is acid sensitive, and next hepatitis C virus is ether sensitive and acid sensitive. Hepatitis D virus is also acid sensitive, and hepatitis E virus is heat stable virus. And next, onset of the virus. So hepatitis A virus is abrupt. So what is mean by abrupt? Like abrupt means it happens suddenly and unexpectedly. So hepatitis A virus, it comes suddenly and unexpectedly. And hepatitis B virus is insidious. So what is mean by insidious? Insidious means they develop slowly and they develop secretly. They causes like a harm in the long run. So they causes harm in the long run. So if you see hepatitis B, hepatitis C, and hepatitis D, these are insidious. The onset is insidious. And hepatitis E virus is abrupt. Next, age. So what is the like average age which infect the like hepatitis viruses? So hepatitis A virus mostly affect the like children and young adults. Hepatitis B virus mostly infect the like young adults, toddlers, and babies. And hepatitis C virus can infect. They can cause infection at any age. And hepatitis D virus also any age. And hepatitis E virus mainly infect the young adults. And what is the route of infection? So what is the mode of infection and what is the mode of transmission? So hepatitis A virus is the like a fecal-oral route. So fecal-oral route means if the food or water get contaminated with the like a fecal matter, it is consumed by healthy individual, it leads to the like infections. Next, in case of hepatitis B virus, so what is the most common route? That is percutaneous. So percutaneous is the like a most common route. And sexual transmission, so both in the homosexuals as in the heterosexuals we can see. And vertical transmission from mother to the fetus also. we can see. So this is most common route. Next, in case of hepatitis C virus also, so what is the most common route? Like a percutaneous only. And hepatitis C virus, so it is mostly transmitted by contaminated syringes. So needle stick injuries. So needle stick injuries are like one of the major major things for like hepatitis C virus they transmit. And another mode is like sexual and vertical transmission. And hepatitis D virus, so same like percutaneous and sexual and vertical. And hepatitis E virus, it is transmitted by fecal-oral route. So it's easy to remember. Hepatitis A virus and hepatitis E virus, so they are transmitted by fecal-oral route. Hepatitis B, C, and D, so they are like a percutaneous, sexual, and vertical transmission. And hepatitis A, C, D, E, they are RNA viruses, and hepatitis B is the DNA virus. So hepatitis B virus, it belongs to the family of Heparnaviridae. So you can easily remember Hepa DNA viridae, Heparnaviridae. Next, incubation period. So incubation period of hepatitis A virus is like 15 to 45 days. Averagely, it is 30 days. And hepatitis B virus is like the incubation period is in between 30 to 180 days. So the averagely it is 60 to 90. And hepatitis C virus, it is 15 to 160 days, averagely 50 days. Hepatitis D virus, 30 to 180. So averagely it is in between 60 to 90. Hepatitis E virus, that is 14 to 60, and averagely it is 40. And next, like uh, fulminant disease. So what is mean by fulminant disease? Which means it becomes like very severe and very quickly. Suddenly it becomes very severe and very quickly. So that is fulminant. So hepatitis A virus is like very rare. That is only 0.1 percentage only. And hepatitis B virus is also very rare. That is 0.1 to 1%. And hepatitis C virus is also rare only, like 0.1%. Hepatitis D virus is very frequent because like it is almost 5 to 20%. So as I told you, like hepatitis D virus cannot causes infection independently. So it causes co-infection with hepatitis B virus or simultaneous infection with hepatitis B virus. So that's what there are more chances of like severe disease. So here, like hepatitis E virus is usually very rare in 1 to 2 percentage only. But in case of pregnancy, it is high. It is 20 to 40%. And next, carrier state. So hepatitis A virus, like a carrier state is none. And C, hepatitis B virus. So the persons who are infected by this one, they act as carrier for long term. And hepatitis C virus also, they act as carriers for long term. And hepatitis D virus, like variable. Uh, and hepatitis E virus is none. And chronicity, which means like prolonged infection. So chronicity, hepatitis A virus is none, and hepatitis B virus is occasionally it leads to the like a chronicity, and hepatitis C virus is very common, and hepatitis D virus is common, and hepatitis E virus is none. So next, oncogenic, so cancer causing. So hepatitis A virus, there it doesn't lead us to the like a cancer. It is not a oncogenic virus. Hepatitis B and hepatitis C, so they are oncogenic viruses. They causes hepatocellular carcinoma. So hepatitis D virus, it may cause, it may not cause, and hepatitis E virus, they do not causes. And the prevalence of infection. So, like what is mean by prevalence? Like how widespread a disease, like it spreads in a particular population. So the prevalence of hepatitis A virus is high, and hepatitis B virus is also high, and hepatitis C virus is moderate, and hepatitis D virus is low and only regional, and hepatitis E virus is also regional. Next, other associated features or other associated conditions. Like in case of hepatitis A virus, the secondary attack rate is in between 10 to 20 percentage. And in case of hepatitis B virus, it leads to the like a HCC. So HCC means hepatocellular carcinoma, and it leads to the like a cirrhosis of the liver, which means like hardening of the liver we can see. and it leads to the like AGN, that is acute glomerulonephritis. So which is like this is hypersensitivity reaction, which is immune complex reaction. And next PAN, that is polyarteritis nodosa, and even it causes arthritis. So these are other associated conditions. So in case of hepatitis C virus, like it leads to the like hepatocellular carcinoma and cirrhosis of liver, acute glomerulonephritis, and arthritis, and it causes cryoglobulinemia. So what is meant by cryoglobulinemia? That is presence of abnormal proteins in the like blood. Next, in case of hepatitis D virus, so it causes hepatocellular carcinoma, cirrhosis of liver, and a fulminant hepatitis, which means like it causes severe disease. And hepatitis E virus, the secondary attack rate is only like 1 to 2%, and it is rarely seen in the Western countries. So, what is the prognosis? Which means what is the outcome of the disease? So, when we give the like a treatment, what is the like response for the like treatment? So, hepatitis A virus, the prognosis is excellent, and in case of hepatitis B virus, it works with the age, and in case of hepatitis C virus, the prognosis is moderate, and in case of hepatitis D virus, so in the acute stage, the prognosis is good, but in the chronic stages, the prognosis is poor, and in case of hepatitis E virus, it is good. Next, prophylaxis, which means prevention. So hepatitis A virus, like we can prevent this infection by giving of immunoglobulin as well as inactivated vaccine. So prophylaxis, like immunoglobulins, ready-made immunoglobulins, they are given after exposure to the disease, which means early in the incubation period. So especially in the like before the like 2 weeks of the like infection will give, ready-made antibodies are given, which provide passive immunity. And next, inactivated vaccine is available. So not only the inactivated, even like live attenuated vaccine is also available. Next, in case of hepatitis B virus, so HBIG is given, that is hepatitis B immunoglobulin, which gives the like immediate protection. There comes under like passive immunoprophylaxis. So this is done after exposure to the disease or even in the early incubation period. And a recombinant vaccine is available. So recombinant vaccine that can be given for like children as well as in the as well as for adults also. Next, in case of hepatitis C virus, so there is no specific vaccine is available. So there is no vaccine for hepatitis C. And next, in case of hepatitis D virus, so if we give the like vaccine for hepatitis B, so automatically it gives protection from hepatitis D also. And in case of hepatitis E virus, so HEV 239 vaccine is available. So this is available only in the China. So this is it is not available globally. And next to therapy. So what is the treatment? So in case of hepatitis A virus, so treatment is none. So symptomatic treatment is given. In case of hepatitis B virus, such as tenofovir, so we use the like drugs such as tenofovir and like telbudin. And in case of hepatitis C virus, so we use the like antiviral agents, so which act upon the like viruses directly, such as NS3 by 4A protease inhibitors, NS5A inhibitors, and even interferons, like we can use. And in case of hepatitis D virus, interferons are used. And in case of hepatitis E virus, so none, that is symptomatic treatment is given. So thank you. Please like and subscribe my channel.